everybody, Dr. Dawn April Ross of the Thought Word Academy. Today I'm coming to you, however, as just a woman who has been on her journey to motherhood and now in the middle of it. One of the things that a lot of people have been asking me for is a line progression video from when I did actually have a successful pregnancy. So I'm going to put that up for you guys now here in this video so you can see. It's been some months, but luckily the lines are still there and you can see them. And I know I mentioned it during the video as well, but I just wanted to make note that I was taking HCG injections during that time. So it was a very small amount. And I did know that I was probably going to get a positive regardless, because I was giving myself the HCG injections, which is what you're testing when you do an at-home urine test. You're looking for HCG. And since I'm injecting myself with it, of course I knew I was going to most likely see positive. However, it was a darker line each time as it was progressing, which is what I was looking for, to note that I was now making my own HCG, and so that was adding to the amount that was going to be showing up on the test. So, people have different feelings about this. Some people feel very strongly that during the 2-week wait, they do not want to know, they just want to wait until they go and have their blood test and are able to have an actual number for the HCG and feel confident in that way. Some people, for them, it feels very demoralizing if they're taking those tests and they're not seeing results, although it can take some time for it to show up. If you go online, you can look at what are the sensitivities of the tests. I highly recommend staying away from very cheap tests. You will see what seem like a lot of false positives, because look, if we're in this process, we are squinting, we are leaning in every light and every shade just to see a line. And you have these indentations, especially with some of the cheap ones, like the Walmart ones that you can get for $1, or the dollar store ones for 88 cents, whatever they are. It can be heartbreaking because it looks like there's something there sometimes. So I say, look, if you're going to go through the process, give yourself the extra days to wait until you really feel like there might be something to see, and you may want to make that investment in something that's a little bit more costly. I was using, I'm trying to remember what it was I was using. Let me pause this for a second, I'll tell you. Okay, I was using the First Response 6 Days Sooner test. And I like that one because, with the clear blue one, you just get like a pregnant or not pregnant, which I was going to get a pregnancy because I was taking the HCG. With the one that I was using, you have the red lines, which they say the First Response is more accurate than the blue. I don't know if that's true or not, but I can tell you that I used the First Response, and it was very clear to be able to see that progression with it. And with that being said, I definitely recommend the investment if you're going to do it in that. Now, like I said, there's two lines of thinking. Some people just want to wait and take the blood test, and that's fine. And they feel that that's good for them. Other people want to take that risk, if you will, that either they're going to feel not happy if they're not seeing a line right away, but again, it may be the timing of how long it takes for your body to create that HCG and how much is going to show up. And as I was saying before, each test is going to have a different amount at which you're going to see some numbers. And I'm pretty sure, and you know what, I should probably check this. Let's see, First Response amount. Let's see. Okay, right. So the First Response, the early result test, which is the ones I was using, says it will detect HCG levels as low as 6 milliliters. So that is pretty sensitive. And when you're doing these tests, as you know, or maybe you're not familiar, if this is your first time, we're looking for numbers with our first HCG really to be, most doctors will tell you, around like 25, 30 minimum. You know, that's really what you want to see. So if you're seeing something at 6, you know, that's a little bit, may not be enough. Again, as you have maybe seen from some of my other videos, you can have a chemical pregnancy, and then you can see numbers that look like they're going up. But how much is it? It's not enough. You don't know until you've taken the blood test and you have the actual HCG numbers, which I will talk about in the video that you're going to see in the line progression. I did write down when we did get the 2 tests what they came up as. So anyway, other people want to take those tests because they feel more motivated when they see a line, or they see the line getting darker, and it's exciting for them and it feels good. You know yourself best, and you have to decide. I tried so many times, and each time I would say, okay, that's it. I'm not even going to check. I'm not going to look. But I know myself, and I'm going to look. That's just me. Other people will say, don't test during your 2 weeks. I think it's a very personal decision that everyone has to make. And there's no right or wrong. It's what feels best for you. So as me, being a person who honestly reads the endings of books before I finish them, I'm going to test early. So without further ado, here following is my line progression for my actual pregnancy with my daughter. Thanks so much. Please check out all the videos on my channel, like and subscribe, and if you have any questions or there's anything you want to talk about, you can reach out to me here on the channel, or if you're interested in any counseling. I do work as a metaphysical counselor, and I do that work virtually, so you can reach out to me either through my website at thoughtword.com or at New Dawn Coaching as well. New-Dawn-Coaching. So thank you so much for watching my video. I hope you'll find this helpful, and that will give you some hope and some positivity in your fertility journey. Take care, be well, and namaste. Everybody, so I wanted to give you a rundown of the test that I took when I actually became pregnant with my daughter, and the HCG was always going to show up as a positive because I was taking injections of HCG, but I knew that that was a stable amount. If I was pregnant, then the line theoretically should be getting darker because more HCG was being put into my system. So if we take a look here, this was at 7 days past ovulation, and I mean there's maybe like the faintest of lines, you can't even really see her. So that was nothing exciting, but by 8 you can definitely see there's a line there. Now again, I was expected there to be some line because of the HCG that I was injecting, but my quest was to see if it was getting darker. So this is day 9 past ovulation. It actually looks the same, doesn't really look much darker. Now remember, this is months old, so this is not, I mean, it's what it looked like, but I can't be 100% sure. But day past ovulation 10, you can see there is a line, still faint. It doesn't look like it's getting any darker. So at this point, I'm just assuming this is all the HCG injection that I'm taking. And then by the 11th day, now we're getting closer because this is, remember, our 2-week wait, and I'm going to be testing on the 15th day past ovulation. Now, it was a 3-day embryo, so even though it's 15 days past ovulation, it's really about 12 days in real term because 3 days you already have of the age of the embryo. Day 11 really was looking a lot darker. I was getting very excited. Day 12, definitely seeing darkness here. By day 13, I said, well, definitely looks darker, but compare it to 8, I'm not really sure. I don't really know if that's really making me feel much better, but by day 14, I'm feeling pretty good. That one is unmistakable. And then we have 15, which is when I went and actually had my HCG checked, and I was very excited because it was at 81. So that was a great number. And then they were expecting it to be doubling at minimum 2 days later. So day 16, line to me definitely getting darker. Day 17, went back again to have my HCG checked. Definitely to me was looking darker still. And that came back at 199. And definitely they said I was pregnant and I was going to go for my first ultrasound a little bit later. And just for fun, I wanted to have one of those wonderful ones where you have a dye stealer, which I had on 21 days past ovulation. And you can see here that the test line is definitely darker now than the control. So this was everything that you can see here, the line progression. You can see the line progression definitely getting darker, even though up until this point until came back with the positive HCG. I was injecting with the HCG, so I knew it was going to be positive, but having the line get progressively darker meant that my body was already creating more HCG on its own. So I hope that this video will be helpful to anybody who is checking out their progression, who may be, whether you're giving yourself HCG injection or not, but just to see how the lines can progress towards a positive and higher level of HCG. Thanks so much for watching.